The Nelson Mandela Children's Hospital has been holding its latest campaign during February, titled Serve Like Madiba. It's aimed at spreading love and encouraging families and children during the COVID-19 pandemic. Now, to speak to us more about this, the importance of this, I'm joined by Ayabulela Poro from the Nelson Mandela Children's Hospital. A very good afternoon to you, Ayabulela, and thank you so much for your time. So what is the aim of this particular campaign?
Thanks, Morena, and thank you for having us. The aim of this campaign is really to raise funds to support the families and patients at the Nelson Children's Hospital. The tagline in particular is called Serve Like Madiba and Give Like Yours. So essentially what we're doing is to implore the public to really put themselves in the shoes of those patients and families who are in the hospital who need their help, and to imagine that those children were their own and to give in the same manner as well.
Now, of course, Utata was all about children, and he was all about children because for him it was, these are our future leaders. This is the next generation, and that's why I would imagine it's important that this campaign continues, yes?
Completely right. And in fact, we're drawing from that example of Mr. Nelson Mandela because a lot of people don't know, but actually he set up the Nelson Mandela Children's Fund, which essentially is the founding organization for Nelson Mandela Children's Hospital. And during his tenure as president, he donated a third of his salary to ensure that the fund could do the work that was necessary to promote the rights of children. And of course, further on in the future, that would lead to the building of the children's of the Nelson Mandela Children's Hospital. So we're drawing from that example of a man who was of service to his own community and really looking at how that can apply to our own lives, but also in furthering his vision to allow children to have access to healthcare so that they can really grow into their potential, including becoming leaders of our continent one day.
Ayabulela, who are you calling on, to be part of this campaign, to join this campaign? Because obviously, everyone's focus is that COVID-19 is affecting them negatively, and they would probably not want to be worrying about anybody else who's going through any kind of particular problem. But who specifically are you hoping joins the campaign?
To be honest, we're hoping that everyone can join the campaign. And I think it's precisely for that reason, because the pandemic has taken so much of the attention, that we're saying that we also need to remember the healthcare needs that children themselves have. Imagine a child who has to go for dialysis treatment. There's a chronic disease that a child is living with, and they're receiving that treatment 3 to 4 times at the Nelson Mandela Children's Hospital. Now, we can't then forget about children like those. Also, heart diseases or the need for brain surgery, those needs don't stop. So we're saying that we also understand the constraints that really are facing the public, but with what little anyone can do, we're calling on everyone to really join us on this journey. And that's why we're making it easy as well to say that you can donate as little as 20 Rand to make sure that you can support these children and their families.
How has it been going? Because it's been, of course, happening for a bit of time now. So how well has it been going?
So actually, this leg of the campaign only started on the 14th of February. And by this leg, I mean the launching as well, that was really accompanied by the launch of the television commercial. But we're really trying to bring in the public to sort of see the needs that the families and patients have at the hospital. So we've only just begun. I mean, we're taking from the theme of Serve Like Madiba, which started last year, but to then add the Give Like Yours campaign sort of element to it, that began on the 14th of February, to coincide as well with all matters related to the heart, including congenital heart defects. So this is going to be a campaign that's going to run essentially for the whole year. And during that time, we're really hoping then that we can draw from different corners of our society, and also then to make sure that we bring in the public to understand really the needs of our hospital.
Yeah. Ayabulela, thank you so much for your time this afternoon. That's Ayabulela Poro from the Nelson Mandela Children's Hospital, and apologies for that impaired line.